Good day, ma'am. Today I'm going to perform assessment of male and female genitalia, anus, rectum, and prostate return demonstrations. So, the purpose to assess and determine if there have any problems or abnormal findings to the genitalia. So, before I'm going to start the procedure, of course, first is introduce and verify the client's identity. So, good day, sir. I am Jason Yamoto, your student nurse of CSPC. And you are, anong pangalan niyo po?
Yes, second.
Ilang taon na po kayo? Okay po. So, kailan po ang birthday ninyo?
June 8.
Okay, thank you very much po. So, next is gather equipment. So, this time I need to use gloves, pen light, if needed, and then alcohol for perform hand hygiene. So next is explain to the client what I'm going to do. So sir, later on I will ask you some questions and I will do inspections and palpation. So, okay lang po ba yan sa inyo, sir?
Apa.
Okay. So, after that, provides for client's privacy. So, assume that we have a curtain and of course, if we have a door, we need to close it to have a client's privacy. So, next is perform hand hygiene. Okay. Okay, so after that, inquired the clients for his history. Okay, so this time, I need to gather subjective data for interviewing the client. Okay, so first is for the current symptoms. So, sir, may nararamdaman po ba kayong masakit sa inyong penis, scrotum, testes, or dome?
Wala po.
Okay. So, in your lesions or penis or genital area?
Wala po.
Okay. So, nararamdaman po ba kayong mabigat sa inyong dinadala po?
Wala po.
Okay. So, changes in color, odor, or amount of urine po?
Wala po.
Okay. So, assume that I have already done gathering subjective data, which is interviewing the client. So, assume that I have already interviewed my client. So, I'm done asking about his current symptoms, his past history, family history, lifestyle and health practices, and so on. So, I'm done assessing for male genitalia. Now, let's proceed for assessing female genitalia. So, of course, I need to introduce and verify the client's name. Okay? Hello, ma'am. I am Jason Yamoto, your student nurse of CSPC. And you are? What's your name po? Okay, ilang taon na po kayo? Okay, so, kailan po yung birthday niyo? Okay, taga saan po kayo? Okay, so, and after that, gather equipment. So, I need to use pen light, gloves, and so on. Okay, so after that, explain to the client what I'm going to do. So, ma'am, later on, I will be asking you some questions and I will going to inspect and palpate. So, may mga times po na hahawakan ko po kayo. Okay lang po ba yun? Okay. So, after that, provide for client's privacy. So assume that we have a curtain and we close it, and of course the door. Okay, so after that, perform hand hygiene. Okay, so after that is let's start gathering subjective data for the client. So this time I'm starting interviewing my client. So so for her current symptoms. So ma'am, kailan po yung date ng last period mo? Okay po. So, ilang taon na po kayo nang niregla? Okay po. Okay. So, may nararamdaman din po ba kayong masakit? Okay. So, lumps, swelling, or masses in genital area? Okay. So, problems with sexual performance? Okay, so fertility problems po. Okay, so assume that I have already interviewed my clients, which are her current symptoms, past history, family history, lifestyle, and health practices. So assume that I have already done gathering subjective data, which are interviewing my clients. So I'm done gathering subjective data for Genitalia, and now let's proceed for gathering an objective data, which is the physical examinations. So now let's start for the penis. Sir, please stand here po.
Ibalik ako.
Okay, so inspecting the penis. Okay, inspect for the base of the penis, and for pubic hair, for the growth pattern, excoritation, and erythema. Okay. So after that, I need to wear gloves for inspecting and palpating my clients. May video ka ba? Go. Okay, so next is inspect and palpate for the skin shaft. So this is the skin shaft to see if there is a lesions, rashes, or and lumps. Okay, so next is inspect for skin. Okay, for color, locations, and integrity. Okay, so next is inspect the glands. So this is the glands. Yeah, this is the glands. Inspect the glands for the size, shape, and the lesions and locations of the urinary meatus. Okay, so after that, wait for urethral discharge. So this is the urethral discharge for squeezing the glands. Okay, so after inspecting and palpating the penis, next is let's proceed to the scrotum. Okay, so inspect the size, shape, and the position. So okay, and then observe for swelling, lumps, and bulges. Yes, and then after that, inspect for the skin, for color integrity, and the presence of lesions or rashes. Okay, and then after that, palpate for scrotal content, yes, which is the testes, okay, the testes and then the epididymis. Okay, and then after that, illuminate the scrotal content. Okay, so if a mass or swelling was noted, look for red glow. Okay, so after that, let's moving on for the inguinal area. So, inspect and palpate for the inguinal and then the femoral hemia. So, this is the inguinal area and then the femoral area. Yeah. So, assume that this is the okay. So, this is the inguinal and then this is the femoral. So, okay, and then after that, inspect and palpate for the scrotal hemia. So, if a mass was detected, okay, ask the client to lay down and note whether the bulges disappear. If it remains, or auscultate for bowel sounds. Okay, so, okay, let's moving on for the anus and then perineal area. So, assume that this is the real anus. Yeah, and then inspect for lumps, ulcers, lesions, rashes, sacrococcygeal area, and rectal prolapse. Okay, so palpate for anal sphincter. So, okay, this is the anal sphincter, yes. Okay, so next is for the rectum and prostate. Okay, so assume that I have done inspecting and palpating the inside of the rectum and then the prostate. So palpate for rectal mucosa, peritoneal cavity, and prostate gland. Okay, so inspect for feces, for blood. Okay, so after that, perform occult blood test if necessary. Okay, okay, I'm done inspecting and palpating for the male genitalia. So, for the analysis data, formulate nursing diagnosis, and then formulate collaborative problems, and make necessary referrals. So, okay, so now let's proceed for the female genitalia. Okay, again, gather equipment. Okay, and then explain to the client for what I'm going to do, and then ask the client to wear gown. Okay, so let's start. Okay, so for the external genitalia, okay, so by the way, this is my dummy for female genitalia. Okay, so inspect the mons pubis. Okay, this is the mons pubis. So there are no signs of infestation. Okay, and then inspect the labia majora and then the perineum. So this is the labia majora and this is the perineum. Okay, so there are no lesions or swelling excoriations. Yeah, this is my clients. Okay, so inspect the labia minora. So this is the labia minora. Okay, so and then inspect and palpate the clitoris. So here is the clitoris, and then the urethral meatus. Okay, this is the urethral meatus, and then the vaginal opening. Okay, this is the vaginal opening. So palpate the Bartholin glands. Okay, so if history or current swelling noted, okay, note swelling, tenderness, and discharge. Okay, and then palpate the urethra. Okay, so okay, now let's proceed for the internal genitalia. So assume that I have already done examining the internal genitalia, which are inspecting and inserting my index finger to the vagina. Okay, so and then assess the vaginal musculature. Okay, and then I have also performing the three examinations, which are the speculum examinations, include to inspect the cervix, to test the STDs, and then unlocking and opening the speculum. Okay, and then next, assume that I have already performed the bimanual examinations, which is I need to palpate the ovaries. Okay, and the next is I have already performed the recto-vaginal examinations, which are inserting in my index finger to the vagina and then my middle finger to the rectum. So, just like this. Okay. So, after that, have already assessing earlier the anus and perineal area and then the rectum and prostate. So, I don't need to say it again. So, okay. So that's all po. Thank you.